here he's being sedated inside his oral area. You know what? This is not a fun part, but it's important. So your experience is a lot better. He's actually getting an implant. And you know what's crazy about this? This is Luciano. He's a facilitator for you guys. And he's getting an implant. So we not only recommend the physician, we also do it ourselves when needed. How was that, Luciano?
Oh, as long as it doesn't touch the back of my tongue, right?
Hear the music in the background. This is something that's commonly done in dental clinics. This allows you to have more of a calm experience, but also to take your mind somewhere else. Something that you're going to notice here is that you don't see the equipment open. They're in medically sealed bags that have been sanitized for the procedure. This is something important that's done, not always done with everybody. So you need to make sure that the physician that you're doing it with, because we do not look, see, it's a seal, complete sealed.
And it's sterilized.
It's sterilized. You see that? You see the, oh, yes. So he's right now unpacking the tools that have been sanitized for the implant treatment that he's getting done at the moment. Now, the equipment that you see over here is what he uses to prepare, to place the implant, but into the bone to make sure it's right. So you see, this is not just done, this is sterilized. So if you guys have any thought, this is the extra precaution that's done so you don't get an infection. That is the primary reason for that, but for also that this goes above and beyond on what you need. But this is very normal. This is, some people think that an oral procedure is very simple, but an oral procedure can be very, very costly if it's not done right. And by choosing some of the services that Luciano does, you can avoid that. You feel that? He's getting the massage, the dental massage. That is included in your treatment, the dental massage. Yeah. The massage, look, see, the dental massage. Something that we just talked with Luciano about was the fact that if he feels anything, that he lifts up his left arm. This enables the physician that's treating you to know, hey, you know what? I need to inject him a little bit more so you don't feel anything. It's very important, but it's something that you don't have to panic about. They will stop and get to the next step. This is a guide, what you saw. Let me show you right over here. And the guide is what helps the physician properly place the implant. Was being sedated. Let me show you what he's getting done. This is what it really looks like. This is a regular tooth, and this is what an implant looks like. Gets screwed in. You see that? And then this up top here, this is called an abutment. And this is the crown that goes on top. Now, it could also be done in, this is what it's called a bridge. Then you don't have an implant in the middle. But Luciano is getting this very particular thing right here. That's what he's getting.
Es totalmente preciso.
This is the, look, you can see how precise this is. It's right on top of his teeth. Exactly. There's no room for error. Preparing to choose the drilling instrument and the right size to make that incision into the mouth to get, it's going to be a little bit of a pressure for anybody that's doing this, a little bit of pressure, but it goes away. And if there's any discomfort, Luciano will lift up his left arm and say, hey, you know what? I feel it. He'll stop right away. And you hear that? It's very, very smooth. You can't even tell he's getting it done. No room for error. As you can see here, there's different sizes for this. Every size has been carefully chosen by physician, so it is appropriate for you. Everybody's different, so this is personalized for very many people. Done computer generated. It's as accurate as it can be. It's guided. Now he's going to apply suction, and now the part of making that incision happens to get that implant in there. You see how it has a guiding light? Oh, he's going to take it out because he already has a pilot hole. Look at that. There's already a pilot hole that he knows exactly where he's going. There's no chance for error. A responsible person getting an implant done and checking his phone. Imagine, it's got a guiding light. Look at that. You can see exactly what he's doing for your safety, but most important, that there's no room for error to get this done because it's already been predetermined by the computer exactly where it's at. So as you can see, right up and close and personal, that's what he's going to get inside. It's coming out brand new. And that's going to be in his mouth in about 15 seconds. The care that's done. And here you go. There's a tool that's good. Grabs it and actually will screw it into there it goes. After that implant is done, there's this other piece that actually closes the area. Let me get the view a little bit better. See how that is? It goes on top and then it closes. Let me get the video a little bit better. There we go. Now that's what you're going to see. He's going to put inside the area so it doesn't get infected. Dad, he's done.
Oh, yeah. Oh, yeah. Like,
This. Look at that. How was that? How was the procedure?
one thing. I did not feel just a little pressure when it started, really. Nothing else.
No pressure.
Little pressure when it started, no pressure later. No, I didn't feel anything.
So you were totally numb.
Yeah, totally numb. Totally, I can't feel like nothing of this happened.
So this is something that's very important that when people are getting dental implants, that they don't have any discomfort, and the physicians try to do their best for that to happen. And in this case, Luciano's done, ready for what, 4 months? Doc?
4 months. I will.
4 months. We'll see you back.
Back then.
Take care. This piece of paper here, what is it?
I call the the implant passport.
This is the implant passport. Whoa.
Imagine that my clinic burn fires or I have an accident and
The train boats you over.
Yeah, something happens to the clinic or me or my assistant. You have the information to go to other dentists
And know what you got.
to get another crown or get another treatment for your implant.
Guys, I'm going to tell you something. This is not something common. Not everybody does this. So know and ask for the implant passport. See you there.